differential diagnosis of hairy cell leukemia. I think the bone marrow biopsies and cell marker and flow findings, and then perhaps some of the lymphadenopathy issues may point one direction to another. But when we see patients like this, what other, the similar leukemia, lymphoma, or the blood cancers that we should be considering or rule out for suspected hairy cell leukemia, just because it's a rare disease. And as we briefly alluded earlier, I do think it is important because treatment could be very different and prognosis obviously very different for some of this disease. So I'll ask Dr. Ravandi to comment on some of the differentials for hairy cell leukemia.
The morphology of hairy cell is quite characteristic. They have these tender projections from the cells, fairly similar in terms of morphology. For example, a splenic marginal zone lymphoma, which also has these projections from the cells. And then there is the very uncommon hairy cell variant, which is about perhaps 5 to 10% of all the cases of potential hairy cell leukemia diagnosis. And again, in terms of morphology, morphology typically is quite characteristic for the pathologist, and flow cytometry markers that were described by a previous presenter are also very typical in hairy cell leukemia. As mentioned, the B cell markers, as well as CD11C and 103 and CD25 are positive, and there are a number of markers that were explained that are negative. In variant hairy cell leukemia, CD25 and sometimes also CD103 are negative. Variant patients tend to present with a higher white count. So at presentation, hairy cell leukemia patients tend to be pancytopenic, although as we said earlier, you can have classical hairy cell leukemia with higher white count as well. But the ones who have high white count tend to be variant hairy cells, and variant hairy cell patients tend to be also older. The median age for classical hairy cell is about mid-50s. But in variant hairy cell, they tend to be older, mid or late 60s typically, and even older. This is important in terms of management because variant hairy cell doesn't respond as well to nucleoside analogs. So if you do come up with a diagnosis of variant, you need to think about your treatment strategy to be a bit different. The other thing about variant hairy cell is, as previously mentioned, they are not BRAF mutated. So that's also a very good marker to distinguish variant from classical hairy cell leukemia. The use of flow markers is not just limited to diagnosis. So we can actually monitor hairy cell leukemia clearance in a number of ways. For example, we have been using soluble IL-2 receptor, which is soluble CD25. Also, you can use soluble CD22, but also you can just use flow markers for looking minimal residual disease. Now, the debate about the relevance of minimal residual disease clearance in hairy cell is extensive, and I'm not sure if we're actually going to even touch on that, but we may talk briefly about it later. But the flow markers are very important to use both for diagnosis and for follow-up, and BRAF mutation is very important in terms of distinguishing classical hairy cell from variant hairy cell.
What assays are you guys using to detect the BRAF mutations? Because I think sometimes we have a targeted gene panel dedicated for BRAF, and then some are more of NGS panels and with a different or targeted gene sequencing, as BRAF just happens to be one of them. I'm kind of curious that whether we routinely do it for all patients with hairy cell leukemia, and then kind of what assays that you guys are using.
Well, I think increasingly we tend to use our institutional NGS panels on most of our hematologic malignancies, for better or worse. So sometimes a patient with hairy cell leukemia has that done really for that reason. But in the past, typically we've simply used immunohistochemistry.
We use PCR for specific patients and then complemented with immunohistochemistry.
We use Sanger sequencing, but I'm not going to go through all the differences between that and next generation sequencing. But my understanding is it's a little simpler and it's more targeted.